Welcome to the July 30th, 2026 Fishers Health Department meeting, 11 a.m. I guess we have to pass we have a quorum, yes. All right, then we have to pass the previous minutes. Motion on that? Motion. Second?
Second.
Ayes?
Aye.
Noes, yes, okay. We're all passed. All right, then what do you do now? Go on to the next agenda.
He was the chair. I know, it's
So
awesome.
the next item,
Let's
can
see.
I switch the
Announcements.
screen to one of you guys because
One here.
my
See how I did
Yes.
that?
is dying.
Thank you.
I have a circle.
Monica, do you have any announcements?
Announcements? I have an announcement to make. Jen has left us. We are all very sad. So we are looking through all the many applications that I've received. I have over 100 applications. So,
Holy cow.
Wow.
yeah, I can't tell you they're all qualified, but there are quite a few are. So it's a lot more than I had for the original posting. So I will be going through those as quickly as I can to find a replacement. But Tuesday was her last day, so we had a little going away gathering. Yes. I think we sent her off okay. She's looking forward to her new role, which she starts in like a week at Payne Manning Children's Hospital as a director of pediatrics for the nursing program.
That's awesome.
Yeah, it's a good opportunity for her. I don't know if there's anything else to announce, but anybody else have an announcement?
Any other announcements? I think everything's going smooth. What do we have? Consent agenda. We have a new business. We're in the new business. Here we go. There you go. You got it. Yeah, I got it. Okay, approval.
Yeah, new business. Can we forward the slide? Who has the slide? Okay, so I think I sent out to you guys all of the link for the draft community health assessment. I don't know if you've had a chance to really do a deep dive into the 150 pages or whatever it was. But at least the front pages, if you were able to look at those, we're sending them out for making them beautiful with a publisher with at least the first half that's short. So I would ask that if you are all had a chance to review and if you're in agreement, if we can vote to accept the community health assessment in similar form to what it is, essential content.
Well, we all had a time to review that, and so I think we can go ahead and move ahead with the vote. Motion. Yeah, motion for that? Yep. Motion second.
It's great.
All right, all in favor, aye?
Aye.
None? No? Nays? Okay, looks like it's passed.
Great,
Yeah.
Go Sal.
Woo!
great.
Moving along, but
Thanks.
We got an annual. Wait, do we have any other stuff, new service? New services,
So yeah, I have a new ordinance that we've been working on just to give you guys an update. That it's not ready yet for council. I know we've talked about it, but the sanitary inspections of massage parlors, nail salons, tattoos, eyelash extensions. So I know Lindsay and I have been working through the ordinance. We think we might have found a way to do nail salons. Yes. Which to me is kind of a critical bridge between all the other personal services. So we're intending to put these all into one like overarching personal services ordinance, correct? And then break it out into the components because a lot of these facilities offer more than one component, right? So I thought we could just discuss at least in concept the fees. These aren't set. These are just kind of for discussion. You guys don't set the fees. It's council, but like as a concept, I was hoping to discuss. So thinking about how to structure this, if we have one overarching ordinance, which I think will be great, when people apply for the permit, then they can select which components they do, and they'll be billed based on how many of those components they do. Because they'll all require different types of inspections. So here, the fee structure that I have would entail like the tattoos, microblading, permanent makeup, body piercing, all that falls under body art would be one component, right? That's carries the highest public health risk for infectious disease, so that has the highest fee. It requires a more in-depth inspection, right? Nail salons and eyelashes, I'm putting as the next tier of infection risk, public health risk. Massage therapy would be the lowest level risk from my view. So,
That's really surprising. Why is that the lowest level?
well, just because you're dealing with skin, you're not like opening skin. Like some of the nail salon things, they're digging into
Right.
cuticles,
And
they're
they're not
grating
using-
people. Like,
I know, I'm just thinking of this area. But they're also not using other
Yeah,
tools.
they're
or
not
anything
using other
that-
tools and things. Yeah, but
That need to be
open
sterilized.
to input from you guys if you think they need to be. But yeah, they don't get sterilized like the nail salons
Yes.
and the eyelashes all have different types of
Yeah.
equipment.
From an ER standpoint, I've had people come in with their tattoos that are infected or
Sure,
whatever.
yeah.
And I've had people come in with their nails that are discolored
Sure,
from the,
yeah.
I don't think I've ever had
Yeah,
someone come in from a massage parlor.
no, I just,
We did have a monkeypox investigation once, but
Well, there's,
they do a lot of different things now with like cupping and. you
Well,
know,
that's true.
some of them
Oh,
do
yeah.
Different, like.
Chief,
Yeah.
you have some input or?
Yeah, just,
acupuncture.
does this cover costs? The fees are not really,
it's hard to know how much it could cost because we don't know how long this is gonna take yet to break it down, right? And the person who will be charged with doing this has other responsibilities that wouldn't be covered under this, so
Okay.
that'll be something we'll continue to look at. I think the tattoo prices are the same as Hamilton County's.
mask is this.
our service is way
It's-
better than him.
It's a bit lower than Marion County's. The massage therapy is way lower than, I think Allen County charges $250, is that right? $250 for that. But it just seems like it should be risk structured from my view, so, open to your.
And risk
input.
is also sometimes commensurate with the amount of time you have to invest.
Yeah.
Right.
Okay.
Right. Yeah. And then I know we've talked about this, some kind of registration process for practitioners. I don't think we're looking at doing that this year, but if we were, like, just thinking if we were registering practitioners, they're all credentialed by the state, right?
Right.
So if there was a need to register practitioners, then that would be like a more nominal fee per practitioner, with people doing tattoos being the larger fee and people doing anything else the lower fee.
To your point about like cupping and acupuncture and other things, Monica, is there a different way we certify that, or is
So
that?
we don't certify those at all. But I do think you bring up a good point, and this is one of the reasons why I wanted to have things together in a personal services ordinance, because then we can add components if we're seeing like that, okay, these things are leading to infections, we probably need to be adding this into an ordinance. There isn't a state ordinance or a state code that health departments follow on any of those things. So I'm not totally sure if anybody anywhere regulates some of that stuff, but there are so many new things that people are doing and ancient things.
Yeah.
Like,
Acupuncture happens to be pretty accurate.
it's very hard to keep up with all of it,
Yeah.
right? Medical facilities are automatically excluded from any of
Right,
these,
right.
so anybody that's operating under a clinician is excluded.
Right.
So
According to
physical
the state law.
therapists would be excluded.
Yeah,
Yes.
Wonder if most of those places are at medical facilities, like acupuncture and cupping. But I feel like there's some massage
Yeah.
therapists that do.
Do
it.
cupping at
Yeah.
least, I mean, the interesting thing about acupuncture is, there's a risk, you're putting
Yeah,
needles
a
in
needle,
people, they have to be, they're either disposable or they
Right.
have to be sterile somehow, sterilized, so I don't know how you.
it's a good point.
That
We
would be
can,
the only
we can
one
look at it.
Because you
I know that we want to get this ordinance out the door
Right.
every year,
Get
but
this
certainly,
ordinance,
like,
just put
as
that
we kind of consider tacking more stuff on.
Under the massage therapy establishments, just to clarify if they're doing anything besides that.
That's a great point. Yeah.
Well, and you would figure that out. And
You
yes.
would when you do
Yeah.
the.
Is there any applicability, you know how we rate restaurants? You know, I walk in a restaurant, I
Yes.
see an A and I'm like, okay, I'm good.
Yes. So
Like a
the-
tattoo place?
Yes, so the intention is that we will associate grading scale with it,
Awesome.
probably as a second
Yeah.
step rollout, like maybe at like a plan for next year because it takes some time to build out the dashboard and to build that grading criteria, but that's the intention, is that there will be grading scales. I think that they will be wildly popular for nail salons at least.
Well, it's buyer beware right now, right? I mean, it's kind of like,
Right,
I gotta get an infection before I don't have to go there.
yeah. So that's the intention, is that we will have a grading
Perfect,
scale
that's
with it.
awesome.
And then because of the nature of these facilities doing more than one thing, we had thought like, okay, like if you have, let's say, 2 types of services, you click that you're doing nails and massage, then we would combine those 2 fees and then offer like a bundled discount, kind of is the concept, right? Like, okay, we'll combine the fees and then it'll be
Like
20%
Progressive.
less than that. Because, it takes less time for us.
The
We don't have to go to 2
Bundle.
places. Yes.
Bundle and
Right.
save.
Bundle and save. Or if they offer 3 types of services, maybe a bigger discount. So this is my
That's
kind of
probably
conceptual approach.
That's the most common. They're usually together.
Yeah.
Right. Right. So you're not having to get like a bunch of separate permits, and you have an incentive to report them all, and then we can inspect them all, right? There are also, and this may be next phase, but temporary permits. A lot of the other jurisdictions do temporary permits. So apparently there's a incarceration festival in Ohio where they have all the tattoo artists come as a festival.
That's why you have temporary.
So there could be
yes.
a need for temporary permits, potentially. I'm not sure if we need to start with that. We don't have anybody doing that I'm aware of. And then just also thinking about mobile service, like if a spa or a facility, a massage place is sending people into other people's homes, like, is that something we need to consider that other places do permit in that way? But so just like whether these fees are appropriate or okay as a starting point, or is this a good concept, I guess, is like from a fee structure. Does that make sense to everybody, or do you have anything else to propose?
Since you mentioned Allen County, do they do that bundling too?
No, nobody else is doing bundling.
Oh, that's, we're gonna have to.
Liberty.
That was just
We're trying to
a
be,
brilliant idea,
I
right?
think that's great.
No, because I think the massages are permitted by the city of Fort Wayne and the tattoos are permitted by the health department, so they're
Oh, so
separate.
that's-
Yeah.
Okay.
This is kind of maybe outside the fees, but I'm curious because it's an ordinance and it falls under the health department. Are you also retaining kind of the similar rights to restaurants? So if you're able to establish causality, so if 3 people get nail infections and you can go and prove that it came from this place, that's not a fine. Can you actually close them until they raise up to standards? Do you retain that right as well, or?
Yeah, I think
Okay.
so, yes.
I just didn't know if that was gonna be part of the ordinance or not, because again, it's, if you can establish this place is actually causal to infections, then that would seem like it's not about a fee, it's about you can't be open until you stop causing infections.
Right.
Yeah, that's a good point. Right now, we have it tied more to if the inspector goes in and finds a violation, then we can send them a notice of violation and potentially shut them down. But I will add some language about,
So you know, that's what, like you with restaurants, well, it doesn't matter your grade, if
So
you
we
find
don't-
that there's
yeah,
an
we don't-
actual public health risk regardless of
We don't
grade.
typically do that based on that unless there was like an outbreak, like let's say hepatitis A or
Okay.
something, and we just had to shut it down until we could establish what who the culprit was, basically,
Got it.
like, and
Right.
it
make
might
sure
be
they were
cause for an
working.
inspection at least to come in.
For sure.
and-
Okay,
Yes.
even something like that, just
Yes,
similar, just kind of that similar authority with you've got with restaurants. and
we
other,
always have
rules.
authority to inspect on complaint,
Got it.
so we
Sounds
can
good.
do that now
Okay.
without the ordinance.
That's even with that,
So,
awesome, just making
yeah.
sure.
I mean, even with a restaurant, if you had 3 people say they got sick at XYZ restaurant, you would go there and inspect, and if everything is fine,
yes,
you wouldn't say, well, we got 3 people, we're gonna close you down.
That's what I'm talking about, you know, causality. If you can absolutely say this did that, then, which is different than people saying they got sick,
Right.
there's, yeah, got it.
Some of the ordinances I looked at have an internal record keeping requirement for facilities that receive complaints from their patrons. I put that in like suggestions to consider as well as a way, because sometimes we don't hear, or the health department might not hear from the patron, but the establishment may as well.
Anything else?
Good to go. I like
It's
it.
great. I like it.
Yeah, I like it.
Liking this concept? Okay.
It's great.
I want the grades.
No one's gonna go to this.
Yeah. Really great.
Yeah, it's great. I want to know where to.
My wife's bugging me to get a tattoo, man, and I'm gonna be calling you.
Yeah.
Place to get an official, like a tattoo, but there are like the microblading and the makeups. We do have several pictures doing this. I thought this would be helpful, just our annual goals that we set this year on what the status is. So the massage, spa, tattoo permitting. So we're nearing completion. We're getting there, right? Establishing the clinical interface or capability to support improving children's mental health. So we are doing final interviews tomorrow for the mental health support specialist position that will sit in clinic and be like kind of that community facing hub that you can refer anyone to get resources and help and get plugged into whatever system. Expanding clinical support for chronic disease screening and prevention. So we've implemented the wellness screens. We're working towards health coaching and a bunch of other things. I put complete because we have done an expansion. We expanded into wellness screenings, which include glucose, cholesterol, A1C, and waist circumference, right? Let's see, coordinate and facilitate increased offerings for peer and community support groups. So we have primarily approached this through the faith community and have had a bunch of good meetings with faith leaders on this and finding out about the support groups that the faith community offers. We've compiled those, we've added them to our community resource list of places, and whether they require a faith component or they don't. And then we're also having a faith and wellness fair for our faith leaders to let them know about our services so that we can, talk to them about that we offer travel vaccines if they're sending out a group somewhere, or that if they want us to come do mental health training for their teams. And I know that our community support team, Brittany, and our health educator, Katie, did a very highly attended mental health first aid training at Heartland with like 20 something people, I think. So I think that has been pretty successful. So while we're not directly facilitating the support groups, we're finding many more than even we realized that we had. So I'm really trying to be that sort of resource hub for those. Expanding community-based follow-up for frequent EMS utilizers. So we have, in addition to following up on all the falls and the mental health emergencies that come through EMS, we have also started looking at all the medical things. So we started thinking that we could limit it to medication review because they were, because almost all of them had a commonality of some kind of medication issue. About half of them are coming from nursing homes. So there's some advocacy we can do there with the nursing home. But we've had a nurse working on this part-time for a month and a half now. And, I think the way that Jen had described it was it's like peeling an onion. I mean, as you would guess, you get these cases and you're just like, okay, one thing leads to another thing, leads to another thing. I know there was one case where we went to the person who had frequent EMS runs, which we are defining as anything more than 4 in a year. Reviewed the medications. Maybe I might be mixing a lot of cases up together, but did the medication review and found that he was taking a high number of supplements that he hadn't told his doctor about, and he laid them all out. And we're like, okay, well, all of these could be contributing to this fall that you had or these other issues that you're having. Let's go through these. So we're very lucky to have a pharmacist as a supplemental staff person. So he's able to sometimes help us review some of those. And then I don't know if it was this person or another person, but the wife was feeling lonely because she was a full-time caregiver for the person who was getting the EMS runs. And we were able to let her know about the resources at the community center, get her plugged into Silver Sneakers. So she's building community and attending and getting a workout. And then their daughter had recently had a baby. And so we had to connect them to WIC. And all of the things that are happening in people's lives. So I think it's gonna be super impactful as we move forward with this. So I'm super excited about where this might go. Let's see, increase reach of each program by 10%. I think we're on track. Our clinic numbers are trending up. Our health education is up. Everything's up. So we'll see where we am. And the community support team is also has a bunch of increase there as well. Let's see, submit readiness to apply for accreditation. We have submitted our readiness to apply. So we have a year to apply. Like it's a whole thing. It's a whole process. So we've submitted our readiness to apply, right? Did I get it correct?
In our 1-year window.
Yes, we're officially in our 1-year window.
Ready to.
So the community health assessment, community health improvement plan, and the strategic plan are all parts of that. We can't apply until those are complete. So we hope that we will apply before the 1-year window is up, like hopefully much sooner. Designing 3 new sustainable non-tax funding mechanisms or vehicles to support expansion of programs. So we're seeking out opportunities for sponsorships. We're seeking out opportunities for contributions to our community support fund. So we have set a separate fund so that when we run into jams and we've exhausted all of the resources, like the trustee's office can't help and we don't have funds, a lot of times these churches are stepping up and supporting the work that we do. So we have established another fund for those. And then we're considering some membership model for clinic services, like if we are to do like health coaching or, you know, if you want to come with some frequency. Yes. Let's see, developing a resident advisory board. JJ, our primary community outreach manager, was out for several months due to an injury. So that got put on hold for a little bit, but she's actively planning for this resident advisory board now. Or council, are we calling it council? Council, resident advisory council. So this is kind of like a PFAC would be in a hospital, like so a patient advisory council, right? But we're using it for all residents. They don't have to be a patient of ours. Just like how are we doing? Can we bounce off like advertising messages? Can we bounce off concepts that we're planning? So those are where we're at on our goals. Good. I thought I deleted that one twice.
No.
Okay,
Let me move past it.
it's not updating. Yes,
Okay.
I thought I deleted that one too.
Okay.
We discussed those last time, so we just kind of, copy forward the previous one and adjust, but I think we settled those last time.
City finance update.
Finance updates.
Yes. I showed this slide last time. So we've been working constantly updating based on our revenue numbers and also our expenses. And as you can see, throughout, we were good in 25, 26, 27. We're expecting a $1.1 million deficit, and that really is due to we've asked for some new positions. So we've asked for 2 new full-time positions, one for the mental, and one for the MIH program nurse, for the program Monica was talking about earlier, a dietitian. We've asked for a part-time medical assistant to help with NPs during clinic time. And then we've also requested one of our food inspectors that's part-time in near retirement. When we need to fill his position, we're going to need to make that full-time. So all of those personnel requests are about a little over 500,000. And then we also had a new position with the mental health support specialist in clinic that this person will be starting soon in 26. And then we asked.
We don't know that we'll get all those positions. Those
Yes.
are wishes.
So that is part of the reason for the increase. Because you'll look at our expenses in orange, it went from 3.2 to 3.7. And then we have slight increases for like vaccines, our supplies and services is included in that 3.7. So we're working with city leadership just to identify other revenue sources through the city to help fill that gap.
And then just for context for all of you all, like one of the exercises that Laura and I went through this year is to bucket all of our activities into 3 types of categories. And I my simple language, she's got fancier words for it, but my simple language is the same way that we went about building the health department, which is the what do we have to do, like what's required under the state code that we have to get done. So what is the revenue that supports that work? And that's the property tax revenue, right? And what are the things that we have to do with that? We have to inspect restaurants and pools, we have to follow up on communicable disease, and we have to do vital records. So what are the positions that revenue supports? And then we had the what do we need to do category, which is all the stuff like vaccines, right? And any of the requirements for HFI. So we put the revenue of HFI in there, the Health First Indiana revenue. We put like any of our stable grant revenue in there. And then what are the activities that we have to do to meet those expectations? And then the third category is what I call the what do we get to do? And those are all the extra things like the community support program and the, more health education and more of, some of this accreditation work and this strategy planning, et cetera. So if we're looking at where these funds are going, and if you're looking to compare other health departments and why maybe they aren't doing all of this in these budgetary times, it's because of the support of the city, number one. And because when we put together the what do we have to do, and what do we need to do, we about break even. It's in the what do we get to do, what makes us special, what makes Fishers great. It's all that category, and that's really where our budget shortfall, that's about the same amount as the budget shortfall, right?
I know in public safety, personnel salary and benefits versus operational expenses usually run around 89 to 90%. Same in public health, or?
We're probably even more than that.
Yeah,
Just
it's about 80% personal
Well,
benefits.
okay.
It's about 80% of our budget. Yeah.
That's pretty
we don't
good.
have any fire trucks. One of your fire trucks
Thank
costs
goodness.
like our whole budget. Okay?
Sorry, I brought it up.
Back then, like 40% reduction in revenue, is that state funding or is that anticipated reduction in consuming of services or is that just?
So
Yeah, 2026, we still had some HFI rollover from 2025, so we were able to use that to support the budget in 26, but that all rolls off in 27.
Okay.
Our HFI funding is 524,000, when in 25, we had 1.9.
Just make, that's what I guess, I just figured, I'm like,
Yeah.
Lions doing something fun.
Yeah.
would like to advocate for public health funding at the state budget next year, that would be greatly appreciated.
Bargain.
So in theory, that's why it's gonna move.
Sure, I don't go very far.
They did, they took it back. What happened?
This slide represents our overall revenue, looking at it from 25 and 2026 in each of the program areas. So you can see that at the same time, at the end of quarter two in 25 and 26, we're pretty equal. Let me see. No, we're slightly lower in environmental, but that's mostly because of how the renewal happened in 25. But we will I expect to exceed our goal, which is 226 for an environmental permit. So that's all the food, that's pool inspections. For vital records, at the end of June, we had 91,000 compared to last year at the same time, we were at 34,000. This is strictly due to the multi-decedent requests for death certificates, that getting opened up on July 1st of last year. So we should definitely hit our target of 135. Then, yeah, we'll go.
110 right now.
And then our clinic revenue, we are trending again above where we were at the same point at the end of June in 25. We had 176,000 compared to 141,000. Our goal is 440,000 for the year. And then so we're up about 34,000 total right now. And then in vital records, we're up over 57,000. And then our other revenue, our health education revenue, is pretty much about the same. So we're trending in the right direction to meet our goal for the year. Any questions on that?
Good job.
And then this slide goes over our goal for the year is to have a clinic recapture of 65%. We're currently about 44%. You see, we've kind of had some ebbs and flows where we were higher in March at 87%. That was due, we didn't have as much vaccine purchase at that time. But then our vaccine purchase has obviously increased as we got into the months leading up to back to school vaccines. And you'll probably see that happen again soon because we're getting in ready for flu and COVID, like purchases. And
But we're
then,
also getting more revenue.
yes, we're also
now
getting.
back to schools.
And then we did have a little bit more staffing expense in clinic just due to more NP hours for all the sports physicals. Again, it's kind of like, you gotta spend money to make money. But we do expect, that to increase for, August and July, like our revenue to increase. And so that percentage should be higher. Our accounts receivable right now is about $40,000 and we're up like 21,000 from last quarter, so.
So I don't think we've updated you guys since we met and started the sports physicals, but I think we've done like, I don't know, I think I personally have done like 150 of them. Yeah.
It may be on one of the clinic slides. And my last update, contracts and grants. So we applied for 2 grants. We applied for this AARP Community Grant Challenge of $12,000. We did not get it. There were over 5,000 applicants. And then we were not awarded this Patient Safety Award prize that was through Anthem, Elevance, and we were partnering with Primary Record on that. And we found out that they did not get to move to the next round. But as far as grants awarded, our FEP, Public Health Emergency Preparedness, annual amount that we received for July through June went up to our previously funded level at $52,700 after it had been decreased for the last 2 years. So that was good news. And that just supports personnel to complete the deliverables for the grants. And then grants that we are sending out. So we still have our School Health Club grant, a little over $6,000 remaining in that fund that we can help school health clubs. And then we did award $500 to, out of our COAG school liaison funds to Thorpe Creek Elementary for a sensory space experience and the nurse's office. So they're very excited about that. And we've got operations updates.
For some of you that don't know who I am, I'm Emily Edwards, the nurse manager. Yeah.
Well, I was waiting for the slide to change. I'm gonna change the slide. Yeah, so Emily's our nurse manager. So all the clinical updates that we've been talking about, she's the one that has to figure out how to put those into action. So yeah, and we used to, if you guys recall, we used to bring some of our program staff in so that you could kind of get to know them and learn a little bit about what they do. So we thought like, it's time to bring that back. So here's Emily.
Sometimes we just throw stuff at the wall and see what sticks. So you can see, as Monica mentioned earlier, so far to date, these are up through June. Wellness screenings, we completed 46 of those. We did go to Ritchie Reserve in April and did a wellness event there. We completed, I believe it was 7 wellness screenings at Ritchie Reserve. We also partnered with our health educators and our community health advocates at that event. So they were able to provide some education around Know Your Numbers and also do some on-site all risk assessments in the resident apartments. We started STI treatments. So far, we've completed 2 of those. I believe that number might be a little bit higher, but when I was looking, I could only find 2, but I think it might be maybe 1 or 2 more. Our walk-in Wednesdays have become wildly popular. It used to be the slowest day of the week, and now it's, I think, one of the busier days of the week. So far, we've completed 153 visits during our walk-in Wednesday hours. Those are from 9 to 4. Sports physicals, like Monica mentioned, 168. The majority of those have been Monica on Tuesdays and Thursdays and a couple of Saturdays, I think. And even some college students, so not just high school.
Yes, I'm getting requests for all kinds of weird things, so.
Wow.
I think there was even a request for a CRL license physical.
Yeah, I turned that down. There's also like a foster child exam and I'm like, I can't do that.
Are those free?
They're $40 for residents and $60 for non-residents.
Three are free.
We just increased it. It was 25 for everyone. So
Next year.
we just updated like last week to the $40, $60 structure.
Yeah, we did 25 initially, 'cause I think that's what the high school was charging at one of their events and kind of looking at other pricing in the area. LTBI medical evaluations again, Monica, we've completed 6 of those. Sharps container collections, 84 have been collected.
Question on that. So I've got a bunch of people in our area that are elderly, and did they just bring it to the health department
In a
in a Sharps?
In a Sharps
container?
container, we don't provide Sharps containers, but yeah, they can just drop them off.
It's not it's not even a Sharps, official Sharps container. It's a hard
Hard
plastic.
plastic, yeah.
Yeah.
Hard plastic.
Oh, so it doesn't
Like
have
laundry
to,
detergent
gotcha.
container would
All
be
right,
okay.
perfect, thank you.
We also have mailbag envelopes, so if residents have pills or patches that they need to return, we have a prepaid envelope, they can put them in the envelope
Oh,
and mail
that's
them.
awesome.
Great.
Yeah.
That's a so, do you have like a designated like medication take back or is it just the mail-in?
Just the mail-in.
The police have a medication take back in the police station, but we're just giving out the mail-in envelopes so people can just pick them up. And people come in and pick them up all the time, and then they can just take them home and dump their stuff in it and then send it off for destruction.
Okay. Is there any thought on an expansion of like medication take backs? Because a lot of things talk about, there is an intimidation level about walking to a police station and that is a major preventer of med take back programs.
Well, I think we were trialing these envelopes because they were so much cheaper. The medication things that like the police have there are out of our budget, frankly.
But of course, yeah.
But so we've been trialing these envelopes to see, who liked those, and quite a lot of people do. But I mean, for sure, it's a consideration and something that we've talked about previously about putting one of those take backs in the community center, like in the entryway, maybe.
We used to co-fund the supply bags that filled the liners at the police station, and we co-fund roughly like a fifth of it a year, $800. So when HFI hit, that was one of the things we pulled back on was the co-funding. And they
So if you
replaced
want to
it with the
advocate for more funds, then we'll be happy.
And there's actually some
I know that that's-
There's actually some challenges to get the bin too. I researched it and talked with somebody, and you have to have a DEA license and do this sort of certification and all this stuff. So it wasn't an easy process. So that's another reason why we went with the mailback envelopes.
Sure, and I know bring that because there are
Yeah.
clinics on site, and then, so the fact that because we now have,
Yep.
it's not the old, now that we have the model, we have a physical location, so it's a massive hurdle, but it is a clearable one because of the new facilities we've got, the folks that we've got staffing, so it's accomplishable in a way that wasn't before, so I think it's.
Fire station has DEA license, so that might be an alternative. People might be more comfortable walking into a fire station and disposing their meds than the police station. And they already have that DEA stuff in.
And they have a much bigger budget.
I don't know anything about that. Oh, man, I'm getting hammered today. That's what I get for going to the bedside.
I think it's also, I think that goes hand in hand with a lot, even if there's just a way when you're talking about like EMS, and if there is a take back at the fire station, this notion that you're talking about EMS active, multiple folks and their medication related. If you're making these stops and you're in long-term care facilities, and you've got the ability to take meds that don't need to be there voluntarily, of course, that would be huge, absolutely enormous. You're gonna, just that right there,
Right.
medication take back is gonna be, that's a really big win.
Walk me through the mail-in service. I request a mailer and you mail it to me.
So I guess we could potentially do that. What we typically do is if we're doing a home visit, the community health advocates have them so that they can leave them with a person if they're doing a home visit. Most of the ones we've handed out have been people that have come in and asked about it.
Okay, so if someone comes to my house, so they're doing a home visit and they have one of those mailers, then the meds go in the mailer and then the person brings it back or I mail it?
You
or-
can mail it from your home. It's prepaid, pre-addressed, and there is a tracking number included in it. So if you wanted to track it, you can.
Yeah,
It goes straight to the facility. They're never open, and it goes straight to the incinerator.
so why not just have those envelopes available at the health center?
We
Anyone
do.
just- So
We do.
we do. So I mean, it's really.
Yeah.
So you don't have to go to the police station, you just go to the health center, pick up this envelope, put the
Yeah.
stuff in and just.
Yeah.
I I think that's,
Great service.
yeah, you're done.
You just have to get people to put the meds in it and mail it. Or bring them to us. That
I
seems to
mean,
be
they
the
could bring it
step
to us
that's
and we
hard.
can watch them put it in and then.
Right, and we
put
can
it in
mail
the
it.
mailbox, right, yeah. Either way.
Either way, I know, but you're right, but it is it's much better than just having like a drug take back day or trying to take them to a pharmacy and that's always hard. Like,
So it's confusing for people to know when to do it. It's,
Right.
so I mean, it's,
Right.
you leave the long-term care facility on rosuvastatin, you get put on a atorvastatin in the hospital, you come back and you get a third statin in your mail at the pharmacy, no one knows about it. Now you're on a gram of statins every day, and you're right back in the ER. It's just,
Right back in the ER with your.
you just don't know because it all looks like the same.
It all looks like
So
the
it's,
same stuff.
you just don't know what you're supposed, yeah, anyway.
This is
Yes.
what we're doing the follow-up.
Exactly, exactly.
And we wonder why people are confused about their health
I
care.
don't wonder. I know.
STI and HIV screenings, we've completed 80 screenings, 4 case investigations, 136 that include TB, LTI cases. And if you're wondering, cyclosporiasis cases, we are up to 12 for Fishers.
Right. Quite eating salad. Nope.
Yes, and we have one person that we're monitoring, traveler from, she traveled to Uganda, so we're monitoring her for Ebola. That will be up August 10th. So far, no issues, thankfully. DOTs, 209 have been completed, and then through June, we've seen 1,730 clients in our clinic. And we did have our back to school theme nights, so we partnered with Parks to provide some fun activities for kids to come in and get their back to school vaccine. So we did a game night. Parks had a video game truck that came in. And then we did a Taylor Swift themed night, which was wildly popular. We had bracelet making and we saw 57 students that night. And if anyone would like a immunity loading sticker or in our vaccine era sticker, I did bring some of them.
I'll admit, I love your chlamydia sticker there as well. That's fantastic.
Computer.
Chlamydia is not a flower.
Oh, man, I remember the brochure for that. I remember the ER. We used to hand them out.
And then we also expanded our clinic hours Monday and Friday, so we're see patients now Monday through Friday from 9 to 4. And then Monica talked about our medication safety review program. And I already mentioned our Ritchie Reserve mobile screening.
Make it all the way around.
Yeah, make it all that, that's, yeah.
Pass them all the way around.
Yeah, I love these. I love a good sticker. I know. Easy. That's right, it is. A good sticker and a good Band-Aid, they go a long way.
Well, I thought if you're lucky.
That's right.
It's 120.
Oh, I like
last year's.
I do too.
Great. And then additional things, I mentioned expanding clinic hours. The milk bank, I think we're just waiting on that MOU to get the wording to get finalized and final signatures on that. So we will be a facility that can accept milk donations as well as mothers can come and pick it up as well.
We're not doing any of the processing, right? You're getting
Yeah.
it to the.
They do everything
do
else.
it.
We're just the
That's great.
middleman. Yeah.
You're the mailman.
The middleman.
The middleman.
We're the milkman. We're the milkman.
Anything to promote that with the milk bank? Do you have like?
I was gonna say, that would be good.
Anyone, sorry, anything to promote that, like for?
Not yet.
Yeah, once everything gets signed.
Oh, it's a pretty good side, okay. Yeah, because that'd be something great to
Yes.
let our nurseries know, our
Yeah.
pediatrician, family
Yes.
practice. That's great, yeah, they would be really.
I sent back
I think it's with them. I think it's with Freedom.
approval.
Like a week or two
At
ago?
least a week or two ago,
Yeah.
and just literally said I need to see the final product before we sign stuff, but otherwise I think we're good. So I'm just waiting on that.
Once you get some form of flyer or something.
Yeah,
Absolutely.
We do have a couple of mobile vaccine clinics scheduled, so we'll be at Fall Creek Intermediate on August 3rd. Fishers High School on August 20th. And then we have Saturday, August 22nd at our clinic reserved for those last minute back to school vaccines. HSE's deadline is September 1st. They have to be up to date on their vaccines if they would like to return on September 2nd. Rabies vaccine pre-exposure, that standing order has been written. So we're looking at being able to provide rabies vaccine for anyone that may need it outside of travel. So vet students, I think, or vet.
So I've written
people
some
who are
one-off
veterans.
orders for some vet students mostly, but we're building the standing order, so that.
And then Monica, you already talked about the health coaching and ear piercing.
Yes.
And
We're
then,
on a little bit of a delay on the ear piercing, just because Jen left. We're gonna blame it on her. And because one of this, we were trying to check from different suppliers, like, you know, the equipment, I think we've
One
only heard
never
from
got back
one,
to
so
us.
we wanted a comparison.
That's why the ordinance is taking so long.
Yeah.
By the way, are we gonna have to inspect ourselves?
No, so.
When you were talking.
Unregulated. So we're only doing earlobes.
Oh, that's right.
Earlobes
We're
are
not doing-
unregulated.
We're not
Yes,
doing radiation, all
right,
this.
just earlobes. Yeah, we stick to the earlobes.
That's what I remember, I couldn't remember, but the, so, okay.
Stick to the earlobes.
Stick to the lobes.
We do your vote.
and then we are also in the process of switching over to a new EHR system called Patagonia. So we've been working on that for a while, just trying to make sure that it has all the bells and whistles that we need to function as well or better than.
It's like very public healthy.
Oh, okay.
And I mean, and for small, like, obviously, we can't afford Epic, so. We would never be able to manage Epic. We don't need that.
Don't want.
Clinical service, is this you still? Or these are Jen's, I think. So here's just all, like, a graph of all the appointments that have been completed through clinic. Green is this year, right? Orange is last year. Blue is 2 years ago. So we're doing pretty good. You can see that we've been exceeding our goal. And we're definitely exceeding where we were in previous years for clinical services. These are where all of those appointments are coming. So you can see we've had a dramatic increase in sports physicals, obviously, because we just started doing them in April, but routine vaccinations are definitely down, and they have been going down for a while. I think that people are not accessing medical care right now that are primary populations that we served before, which presumably for documentation reasons for immigration status, just as a guess. But it's a very noticeable decrease in vaccine. So it makes it a lot harder to make up the difference that we thought we were going to make, because we're adding all these new services and we're just breaking even essentially.
And that was because before that, a good number of people that were from immigrants that were getting the vaccines.
Yeah.
Is that right?
Yes, yeah, because we participate in the Vaccines for Children program, because we are an easy place to access for a 317 program, which is for uninsured, not underinsured. But there's a noticeable decline in people accessing medical care in general, and all the health departments are seeing this. Now, can you go back? Who's flipping around so fast? Okay. Travel clinic, those are, it doesn't look as dramatic as it feels, but those are definitely up. That has been popular.
20 a month, that's
And we
great.
have been, we raised the price on that too. So we kept the base price at 60, but we added kind of extra 20 for non-residents. 40, I think 60% of our travel clinic patients are non-residents to Fishers. So we added
How much would you say?
like 60%.
Oh, yeah, yeah.
Yeah, we're drawing from a pretty big area. So
Yeah, you're getting like probably Lawrence and. like that.
Carmel, Noblesville, anybody, because
Oh, that's true. It's not- it's not-
there's
yeah, it's not
nothing
Hamilton
nearby.
County.
Passport Health is all the way down in Nora.
Yeah, or you have to go all down
Plainfield.
to Riley.
Most health departments don't offer this. I think Monroe County, you, Delaware, Alley County. Alley County doesn't do kids under 8, so they've been sending kids to us. So we've had
I
people
tell people
driving.
too. I'm like,
Chief.
go get your.
Chief here has a recommendation to raise the price.
We just raised the price like last.
It's okay. It's very entrepreneurial. We're an entrepreneurial community.
Should we rip the Band-Aid?
Smart, vibrant, entrepreneurial.
200%.
Disposable
we
income
got a
to travel
shortfall.
internationally, I would argue.
Yes.
You can
Bravo.
We raised it another $20.
Yeah, you can what do we charge?
Raised 2,800 extra dollars.
That's a
It's
consultation
60
fee.
for the consult fee
Right.
versus 80 for non-residents. So 60 for residents and 80 for non-residents.
That's more helpful, 20 years.
Like $100.
I do 100. I do 100 and 150. And I,
Well, here's the flip side. Costco is now offering travel vaccines. Okay, and their rate that they can acquire the vaccine the actual
Well,
cost
they
of the
can-
vaccine is so much better. We can't compete at all with the price of the vaccine.
But it doesn't matter.
Based on Costco. Now, and they just do a telehealth consult and then send them into the Costco pharmacy. So.
I
how
would
much
give you
is
$100 to not go to Costco.
But you have to get the membership for Costco, right?
Yeah, but a lot of people have,
Yeah.
especially people who travel.
So we don't want to tell people about this, but
well,
but
is
it is
Costco
more
charge us for the virtual visit?
Yes.
How much do they charge?
I can't remember. I know we looked at it.
$39.99.
Oh, for the very, it's very cheap. So we're trying to balance.
They're not making, they don't, it's interesting, they don't make money off of their stuff, they make money off their membership. There's a podcast called Acquired that talks about their whole history, it's very fascinating. So you should, it's a long podcast, but it's so cool to hear Acquired, to hear the history of Costco. It's very fascinating.
Okay.
I would say most people are walking out spending about $500
Well,
That's for an appointment with all of, because there's a $20 administration fee for each vaccine.
It's a behavioral health
So
thing.
it's,
You can't walk in there without spending $500.
Yeah. But you're saying.
takes
you're
a lot
saying
of work
it's
not to.
$500. It's
With all-
$500 here for us.
yeah, with all the vaccines that they need and the
Yeah.
consultation fee, it's $455. People are walking out spending that much per person.
So your $60 does not include each vaccine fee, right? Because that's on top of it. Well,
And we
that's my
charge,
point.
and we charge 110% of the cost for the vaccines.
For the vaccine.
Like,
Okay, so you're
like,
making,
to cover the administrative management of the vaccine.
But even if we raised the non-resident fee another $20, that would only address 0.2% of our budget shortfall. So, no.
So we gotta raise everything.
we gotta raise that.
This is ridiculous. Costco?
I'm not telling anybody about
No,
it.
no. I might still just come here to support Fisher's Health Department when I need it, but that is very convenient. $39.99, of course they're doing that.
So there's that. They started doing it like the
Usually
same
that's what-
month or like, they started doing it like right around the time we finally got ours off the ground and we were like, are you kidding me?
I bet the Noblesville Costco
Yeah.
has a ton, yeah, I bet there's a ton of. Wow. Yeah. Okay,
So anyway, there's that.
there's that.
We can move off the slide now. Team Public Health Academy was last week. It was good fun. The kids did all sorts of things. Big success this year. I think we had over 40 applicants and we only had 20 spots. So it's definitely word must be getting out. So they had fun. They were at the farmers market last week doing their health education day. We've also, I think today is the second of the Tiny Taste Test Try days. A lot of teas at the Agri Park. So they're having like, you can vote. I think today is tomato versus banana pepper. So you can vote for which one you like better. Last time, I think Team Cauliflower beat Team Broccoli.
What?
No, bell pepper. Team Cauliflower beat Team bell pepper. Yes. So anyway. The aging well classes are going well. We have a bunch lined up for August. The ones that are using the Alzheimer's Association curriculum are really, really popular. And then, as I mentioned earlier, our community support team, we have final interviews tomorrow for the mental health support specialist. We got a lot of good applications, so I think we're excited about that. And then I pulled this graph. This is for our community support team. I don't think we've ever showed you guys this before, but so our community support team includes Brittany, who does the mental health follow-ups, includes our fall prevention, and now medication, soon to be medication, the medication reconciliations, and the other kinds of follow-up. But you can see that it's really taken off this year on the number of encounters that we've had. So
Is there,
They've been
are you
busy.
hiring more people for that or no?
The mental health support specialist will help support some
Okay.
of that work because they'll be office-based, right?
Gotcha.
We
And
presented
we've
on this.
requested a nurse to support the,
We presented on our approach to community support, public health, MIH at NACHO, and I went to a lot of sessions. I would say ours was one of the most well-attended sessions.
yeah, I forgot to mention, we did have two people, or three presentations at NACHO.
Yeah,
So-
two, and then.
So we had one
did
for the
panel.
community support work with fall prevention and then, and just the approach in general. We had, Casey presented on her hidden in plain sight, like vaping mock teenage room that we pop up at the schools and stuff where you have to find the vape. And then Josh presented with Credible Mind, which is, our mental health website. So I think it was good showing. And our fall prevention team won the Model Practice Award for NACHO. So that was pretty cool too. And I think Brittany and Daniel won an award from the,
Indiana Suicide Coalition, something, but
for suicide prevention for all of their work. And they'll receive that award on the 5th, I think.
5th.
Yeah. And then this is just the medication safety program. So I know that it really is just through the month of June that we had started doing it, and we'll have July numbers after next week. But quite a lot of work, and you can see that 51% were in skilled nursing. So definitely something to address with nursing homes.
Okay, well, we talked about this a little bit earlier, the visual summary, the short digestible section of the King Health Assessment has been fully designed by the PR team, contractor, the firm that does this work. And then they promised delivery of the narrative summary. So this will be the full report by August 11th. If you want a copy of the finalized visual summary, because I don't think that's the version we were able to send out to you, but it's the same content, just looks better. We can send that out. On our community health improvement plan, we brought together 18 members, stakeholders from across the community. They represented a lot of medical, social care organizations, schools, both trustees' offices, private providers in the behavioral mental health space, to do 2 sessions that I hosted and 1 long working session. And the goal of that was to get a broad and diverse input on what some of our community health improvement plans should be, not just for FHD to own, but for community partners to own in collaboration with us, either by support or as co-lead, stuff like that. And that ended with them doing a large group voting after breakout groups to come up with 3 priority areas for the community health improvement plan. These won't supplant like our health pillars, they'll be complementary to it. One is very familiar to stuff that we've talked about before, mental health for all ages, with this priority focus on youth and families. And there are 3 objectives right now, the current draft of the CHIP. I'm finalizing their feedback and sending that back out to them for final feedback this Friday, and I can share that version with the board as well. We're already getting some action on some of these community partners leading stuff. So underneath the mental health one of the objectives was to strengthen partner coordination for youth and family needs through creating or convening like a local practitioner and community partner committee. And one of our CHIP committee members has already formed that and has 10 participants. So we're trying to support it by adding ourselves into it and then getting some other system providers into that, for example. Second one is social connection and belonging across the lifespan. They really wanted to broaden the social isolation and connection point beyond just like subcomponents of some of the health pillar work that we've talked about, and think about it more broadly, but to do it intentionally. And one of the objectives under there is to sort of try to build this social connection and belonging model through the use of one committee member named it like neighborhood ambassadors, people that are more aware, more connected within a real level, to be ambassadors within their own very local community. And we've started a similar effort with this as well. Katie Wilkinson, one of our health educators, has started a Aging Well ambassador type of model where she has 5 connected older adults in the community that she shares resources for her program area with them, and they share it out. And that seems to have helped get more like focus and participation on some things. And then the last priority area that they mentioned for the CHIP was this idea of a community resource and navigation connection system. And Monica alluded to some of this earlier, talking through the community support facilitation and collation of resources work. To talk about, the group felt, let's start with really understanding the landscape of every opportunity across your life course that exists already in Fishers before just trying to create additional new ones and build out a better system that's promoted and collaborated through a lot of different partners to identify resources that touch on everything, whether it's interest group or whether it's life stage or health condition or like caregiver support stuff. And I know that our HEPL library director is wanting to be heavily involved to help lead that with some of her librarians and some other partners as well. And so we'll get a chip out by next month and then also have the opportunity for everybody here to feed into that as well. So like I said, this would be complementary to our work. Some of it we may lead on sub-objective components. Others will have community partners that'll lead. And it'll be stuff that we'll like publicly report on our website to show progress towards some of these health improvement plans. And it'll also roll in a bit to our strategic planning work that we're going to do over the next 3 to 5 years, but developing that strategic plan over the next few months. And so as I said, like the final design with the CHA should be done in the next 2 weeks. The CHIP is drafted, just getting some of this final feedback in and send that out for the board's feedback. On the strategic plan, we'd like to start working on it so that we can have it done between this August and October timeline. It'll highlight some of the CHA stuff, the CHIP outcomes, but then some internal priorities. So we just completed a competency assessment as part of our workforce development plans. That's a component of FAB accreditation requirements, but also just to help us improve our staffing, our training, our internal processes and stuff like that, and employee satisfaction. So we'll roll in a lot of things and try to make it concise into a strategic plan. Do have an ask is that for our accreditation, it's required that we have at least one board member be part of our strategic planning process. And the commitment for that can look anything that fits to the board's schedule on whoever wants to participate. It can be from a distance, it can be remotely, it can be coming in when we do a strategy session. We can really tailor it, but we do need to have at least one person from the board.
How many sessions are you looking at?
Well, we're going to do at least one session with the team, and I think that could be a good opportunity to slot a board member in as well. So one working session.
So who wants to, Chief? Who wants to do this, Chief?
I just had a quick question. It's very nuanced.
I'm in.
We need a motion.
You volunteer.
Just thinking about this, if there's ever been like a funded initiative, CHIP is a fairly prominent acronym already in public health.
Yeah.
So I didn't know if you had thought about that, saying, because if there's a newspaper, it's like Fishers is funding a CHIP initiative. It just seems, I didn't know if you had thought about that acronym at all.
Oh.
It just,
like-
maybe it's the Fishers HIP,
thinking-
FHIP, because as soon as you start putting things together, I just thought
Yeah,
maybe
but
CHIP is a fairly
centers
prominent
and-
acronym, Children's Health Insurance.
Oh,
It's-
children's health. Oh.
Yeah, so it's just a fairly prominent acronym in health, public health already, so.
I like that suggestion, the Fishers Health Improvement Plan.
Just something to think about,
Within the
because it's a fairly
acronym.
prominent acronym, so I just didn't know if you want to tread right on top of that.
Yeah.
Just figured I'd point that out.
With an F.
Well, we do try to stay away from acronyms that nobody else knows when we're communicating with the public.
We're like,
And CHIP is, even if you know, it just seems like it's, yeah. So anyway,
I like it. We received that feedback from one of our CHIP, FIP steering committee members because the group originally said mental health with a focus on youth and the family unit, but then there is the discourse around family units and how that may exclude some people from the perception of participation, stuff like that. So that's why we changed it to youth and family. So good point.
We're gonna have fruit.
I'll have food. I'll have food. Hey, if it gets you through the door, tell me what you want to eat. So when we get a better draft, the CHIP report's really short. The CHA, is 76 pages of content. to 30 pages of appendices. The chip right now is 9 pages. And my goal is to keep it no more than 15 pages. But when that's ready to share out, we'll share that for feedback. And then I think we just agreed that Chief Arusa.
Yes, sir.
Yeah, great. Real quick, we're in the accreditation process. They just released their new standards and measures. So it's called version 2026. Doesn't really impact our internal timeline and goals of being ready to have our on-site visits and go through the formal accreditation review and outcome process mid-next year. But just FYI, it is under a new definition of standards. It makes our lives a little bit easier in terms of documentation requirements, but we had already done so much work that it kind of sucks because some of the work that we did is no longer required, but it's good work anyways.
Looks like we finished through the agenda. We're on to regular items. Do you have any unfinished business?
Motion to adjourn.
All right, I got a motion to adjourn.
Second.